Guys, welcome back to Medical Coding with Blue. Today's episode is all about the road to becoming a medical coder through alternative positions. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, the road to becoming a medical coder is sometimes not a straight one, okay? There's going to be times where it may depend on where you are in the United States, and the area, and the amount of hospitals and things like that, that it's going to require different amounts of coders and things. And sometimes these job listings are under different names, not just medical coder. It's under like health information technician or medical records tech, something other than medical coder. So a lot of times people are not finding jobs because of this, because they are insisting on putting medical coder, remote medical coder, and not all positions for medical coders are listed that way. So some people are going to be looking for a long time because of this. And because of this, sometimes they say, well, I just want to take an alternative job position just to get my foot in the door. There are three that I recommend. These top three, there are others, but these top three that I recommend and that I have always recommended are going to give you transferable skills and use your medical coding knowledge at the same time. So that's why I say that when you start out and you're looking for a job, make the time valuable. If you cannot get into a medical coding position because your resume is not very good, because you're not getting out there proactively, because you're not looking for other titles of jobs other than just medical coder, again, you're going to be looking for a long time. But looking at these other positions may help you to get in somewhere, right? So the first one that I will say is medical biller. Now, with medical billers, they do not have to be certified in medical coding at all. They don't even have to be certified in medical billing. And yes, while there are medical billing credentials out there, it's not required. When you're looking at the job listings, you will see that all they're really asking for is a high school diploma or a GED. Do I think that it is a good idea for medical billers to understand coding and know coding and all the other stuff that goes with it? Of course, because these are the people who are submitting the bills. And sometimes at certain places, there is no medical coder and the biller is essentially doing everything, okay? Because people just assume that the electronic medical record is coding appropriately and, you know, the doctors are selecting all the diagnoses and the procedures correctly. And a lot of times they're not, you know, doctors and other providers, nurse practitioners, PAs, they are not meant to be medical coders. That's why we have a job. Okay. That's why we have a job. So keep that in mind, guys. So, but starting off in a position like medical billing is great because it's going to give you that full picture of what it's like, not just on the coding side, but also on the actual revenue side, actually submitting the bills and actually working with the insurance companies, working with the patients and that kind of thing. If you don't want to start out in medical billing, don't start out in medical billing. Don't foo-foo my advice though in the comments because you will be blocked. The reason that I say this is because there's a lot of people out there that are just looking to get in and maybe they just don't have the opportunity to get in. So me giving the advice of starting in medical billing, sometimes people don't think about that. So I'm talking to those folks. If you have your own way, by all means, you go and do it. Or you go and do your own way. But again, I'm talking to those who want the advice and who are saying, okay, well, maybe this is an area I haven't really looked at. Maybe let me go ahead and try in this way. Because sometimes they'll want you to start off in billing before they get you into the coding. You know, so that's just one place that you can start. Again, it's going to give you those transferable skills. There's nothing wrong with starting in billing. You know, billing, you're going to see a lot. You're going to understand why insurances deny certain claims. That's going to make you sharper because when you go over to the coding side, then you're going to know, hey, if I'm picking this up, I've got to make sure that all of this information is here because this particular insurance needs to see all of this documentation. That we use this particular modifier for this insurance company. You are going to know that, right? versus a coder who's just in there coding and they're not worried about the money. They're worried about the coding, and you already know the money side. So you're going to understand again what they need. So that's going to make for a lot more cleaner claims that are going to go out because you've had your experience as a medical biller and now you're in medical coding. So I think that's a fantastic way to start. And like I said, it's just a really good thing. You could put it on your resume as experience, obviously. You can say what kind of place that you were doing the billing for. Was it a place for like cardio or ortho or neuro, any of those, and just letting the person who's reading the resume know what kind of insurances did you work with. Was it Medicare, Medicaid, TRICARE, Aetna, any of those? You know, you got to list all of that detail in your resume. All right, so that's just something that you can use as transferable skill that will get you in. Because somebody who has billing experience versus a brand new medical coder with no experience, they're going to look at that biller first for getting in. Because not only that, with billing, you also get exposure to the electronic medical record, all right? And so that's also another skill that you could put onto your resume. So these things, they add up, guys. All this detail literally does add up, okay? The other one is going into risk adjustment. Now, I will say as a caveat, risk adjustment is a pit stop. This is a very short amount of time that you should spend in there. The reason that I say this is because I do the research on the job listings. I have personally taken the time and hours to look in different parts of the US what they're asking for when they're looking for medical coders. And what I have seen on, of course, the medical coders is, of course, they want 3 to 5 years experience, blah, blah, blah. We already know that. But some of them I have seen, if your only experience has been with PT and OT, or if your only experience has been with risk adjustment, this does not count as experience. The reason being is that they are very limited as to what they do. With risk adjustment, it is only diagnosis coding. So you are not doing procedure coding. You are not doing evaluation and management. You are not applying modifiers. And a lot of people get sucked in to just doing diagnosis coding that they forget how to do procedure coding. And then they lose that skill. Well, what happens when you lose that skill? Now you're rusty because you haven't been studying. And because you haven't been studying, when you're out there applying for other jobs, because maybe you're getting tired of the repetition of only coding for diagnoses, which I've heard that before. Some people say, well, Blue, I'm just so bored with doing diagnosis coding. I want more of a challenge. Okay, so go out there and apply. Well, now I can't pass the assessment test because I haven't been doing evaluation and management and I haven't been doing procedures. You can study, guys. Pick those workbooks up and study again. So that way you can keep that skill. And if you've gotten rusty, it's okay. It's like riding a bike. You'll be able to get back into it all over again. So don't even worry about that. If that's you, just get back on studying, all right? Because that's the only way you're going to be able to capture all of those things again in your mind, in your brain, okay? You want this career, right? And don't get all excited just because, oh, it's just diagnosis coding. If you stay there too long, you're going to get very rusty. And again, if you stay there too long, they're not going to count that as experience. So make it 6 to 8 months that you're there. And again, that's going to get you exposure to the codes. They're going to know that you're brand new, right? And that you're getting your experience. But at least you've worked somewhere else first and you've had that exposure to what notes look like. You've also had exposure to, again, the electronic medical record. And that, whichever one they're using, eClinicalWorks or Epic or any of those, that can go on your resume. And again, you going up against a brand new medical coder who has no experience anywhere is going to put you ahead of the pack because you already have experience with the electronic medical record. You've already looked through notes, so you know what to look for. And you understand that part, okay? And so you are still brand new enough that you haven't developed those bad habits. And, you can do all of those things. So that's why I say risk adjustment is another good position to get into. But again, please hear me when I say make it a short amount of time, 6 to 8 months, okay? And people will get upset with me about this. Well, no, Blue, I am a senior risk adjustment coder. This one lady fussed at me. I don't care, guys, because again, you're only coding for diagnoses. And while risk adjustment coding is very important for statistical reasons and all the other stuff that the insurances use it for, it is very important. However, it can be damaging to the medical coder who has not continued to study, all right? Because our goal as medical coders is to make sure that we still understand fully diagnosis coding, procedure coding, evaluation and management, and modifier application. So that's those 4 things, guys. We have to keep those up. And it's not an excuse. Oh, my job has only been with risk adjustment. It's still not an excuse, guys. I'm just saying. So that's the second one. So billing is the first one that I recommend. Risk adjustment is the second one. The third one is prior authorizations. So with prior authorizations, you are not coding. You're not coding. However, you are contacting the insurance company and you're given a record and the doctor says, the patient has this condition. I want to do this procedure. Call the insurance and make sure that it's okay. And then you talk to the insurance company. And again, having that communication with those different insurance companies is going to go right onto your resume. And again, working with the electronic medical record, again, going right onto your resume. And you're going to say, okay, well, here's this diagnosis. Here's it for this procedure. Does it support? Can we do this? And the insurance company say yes, or they'll say no. And then if they say no, you got to go back to the doctor and talk to them about that. And then you have to, do that whole process that way. But knowing what diagnoses kind of go with what procedures is, again, going to put you ahead of the pack. Because as a certified medical coder, you're not having that whole burden of, okay, now I'm a brand new coder. I've got to look up all these diagnoses and I'm going to be thrown into the deep end of the pool. This is already being given to you. The diagnosis code, the procedure code, and you got to make sure that it's okay. Right? But what, again, puts you at the head of the pack for somebody else that's applying for prior authorizations that does not have their certification is that you understand the medical language, right? You understand the medical terminology. You understand the procedures. You understand, the diagnosis codes and things like that. So that's, again, going to put you ahead of the pack versus somebody who does not have that experience and does not have that knowledge already. So it's just about being prepared and looking at it like, okay, I can start here. And even though you start and you get the job, any one of these, the billing, the risk adjustment, or the prior authorization, it does not mean that you have to stay. You can continue to apply. And there's a lot of people that as soon as they get that job, then they want to stop looking for a job. Well, it should motivate you to continue to look for work because you got that job and that should build your confidence to be able to get the next job. Okay. And if you say, well, Blue, I don't want to look like I'm hopping around from job to job so quickly. It's not that way in this industry, guys. They understand this. There's going to be different facilities with different types of rules, and they understand that coders sometimes will leave because they need a challenge. And sometimes coders will start at a place and they get bored very quickly because it's very repetitious. And then they seek other challenges. And then if you find a place where they're willing to give you that challenge, then that's a good thing, right? And so that's where you have to think, oh, okay. And a lot of times these employers are not really looking at that. They're looking at what have you experienced in this time, okay? And then you can talk to them when you're in the interview. If they ask you, why are you going from job to job? And you could say, well, I'm looking for something that's going to challenge me because at this position, we were doing a lot of the same thing, over and over. And you just want something that's going to give you that push to learn more because that's where you are. You want to learn more, right? And as medical coders, that's what we do. We learn, So billing, prior authorizations, and risk adjustment. Any one of these, okay? And I will say this also. Apply at the temp agency. The temp agency, you can Google in your area. If you go to Google and you type in temporary agencies for medical professionals, you will see everybody pop up in your area that has that. So there's temporary agencies that specifically have the jobs for medical professionals. It'll be doctors, nurses, medical coders, medical billers, because believe it or not, sometimes they need us, right, on a temporary basis. It will not be for one day, okay? You will not be called in only for one day, because that's not the way that it works. If a medical coder calls out sick or if they're on leave, then that work is waiting for them when they come back. However, if they are like, maybe they're on maternity leave or something, or maybe they're taking some other kind of extended leave, they may need somebody to come in and fill in. And so that's when they call the temp agency and say, hey, do you have somebody? And then by all means, oh yeah, here we go. So that's how you can get in. That's how I got in, guys. I got in through the temp agency. So, that's just, it was my way to get in. And that first job that I had was only a 3-month assignment. That led me to my next assignment, which should have been for 5 years. But again, I was trying to apply to get back to my hometown, and the closest that I could get was a short distance from my hometown. But I still applied, and I got that job. And it's a permanent job. And it's my forever home is where I am now. But had I listened to other people, my other coworkers at the second place that I work were like, oh no, you should never try to apply because they're never going to hire you. I said, well, the worst they can do is say no or ignore me. And that's the boat that I'm in right now. So, and what do you know? I got the job and I've been here ever since. So, it's not always how you think that it is. Okay. And I will just leave it at that. But sometimes these temp agencies also get contract positions, okay? They get contracts for like a year. Sometimes they get them for 6 months. Sometimes they get them for 3 months. It really all depends on, who is what and what are they doing. So like I said, the only way you're going to be able to know that is if you apply with a temp agency, okay? Make sure your resume looks good. I can't stress the resumes enough, guys. If you have, and please do not do this, please do not have a 3 to 4 or 5 page resume. I see that on LinkedIn. People are so proud. I'm like, why? It's this 3, 4, or 5 page resume. Immediately when I see that, if I'm a hiring manager, that's immediate rejection from me. Because number one, you are not knowing that you're wasting the person's time doing that. They have about 10 seconds to look at your stuff and if it's going to grab their attention or not. If not, they'll go on to the next resume, okay? So 1, but 2 pages max, okay? Ideally, it's on 1 page, but 2 pages max, okay? And go back only 10 to 15 years, okay? Don't go back to the early 2000s. Do not go back to the 80s or the 90s. They don't care, and that experience is long gone. So 10 to 15 years and up, I'm just saying. And to close this video out, I will say this. As a medical coding student, getting into the school, graduating the school, getting your certification, you are entitled to nothing. And now I say this and you may sound, oh, Blue, that sounds mean. It's not meant to be mean, but I want you all to hear me when I say this. You're entitled to nothing but working hard, right? Working hard to get where you want to go. No one owes you a job. Now, if you follow me on LinkedIn or Instagram, I posted a message from a viewer who was very entitled and said that if they didn't get an entry-level job, they were going to do a chargeback on their credit card. Well, then that's theft, because the school did its job, was to train you, and you signed off on that. So if you do a chargeback, again, that's theft. The second of all is no one is going to hand you an entry-level job. If you look at the job listings, all of them want experience. But how are you supposed to get experience if no one will hire you? That's when you have to be out there and you have to be proactive and you have to still apply anyway. Because they're going to say that. Because they want to run off people who don't want to try hard. Now, you want to try hard and you want to make sure that everything is right. your resume looks good, that you can pass an assessment test. Because again, if happy coders are in the area, they'll stay. So that employer is going to be at the mercy of whoever applies. So that's why you have to make yourself look as good as possible and show your skills. If you want this, this is how you get it. It's not by being demanding and saying, oh, I'm owed this, I'm entitled to this, because again, you are entitled to nothing. You have to work for what you want. If that's not what you want to do, if you want to do something easier, there's a ton of other things that you can do other than medical coding. Now, if you stick with it, on the opposite side, right? If you stick with it, if you get yourself out there, if you're proactive, and if maybe you try one of these alternative positions and you get in and you take that experience and you build on to the next thing and the next thing and the next thing. And then you'll see what a rewarding career it can truly be. Instead of, what do I get? You'll be more of, this is what I can offer. And this is what I can experience because I have so much to offer. Right? Because if I did that, if I said, oh, I'm entitled to this, I have all these years of experience, I'm entitled to this. Me personally, Blue, I'm entitled to nothing too. I have to work for everything. Just like you all have to work for everything. Again, no one owes you anything. You have to work hard and you have to be willing to put the time in. You have to be willing to do the falling and get right back up. And that's the way that it is, guys. It's life. It's life, and it's any career. Even lawyers have this issue. New surgeons have this issue. Nurses have this issue. Although some people will tell me that it's a little bit easier to start as a nurse than it is getting in as a medical coder. I don't understand how that is, but whatever. But I'm just saying, you guys, it's a journey, and it's going to be a commitment. So if you don't have that in you, if that's not what you're interested in, then there's plenty of time for you to still choose something else. But again, if you are willing to take that and go for the ride on it, it's going to give you such a wonderful and fulfilling career, something that maybe you would have never have expected. Because I certainly never expected this. I never expected to be this far into my career and have a YouTube channel and have a Patreon channel and, be encouraging people or, helping people to get through and to get through school or to get through the resume part or to do any of those things. It's a wonderful feeling, and I'm so grateful and I'm so blessed for that. So again, guys, you're entitled to nothing but hard work. That's what you're entitled to. the hard work that you have to put in. Okay, it's just my advice anyway. But yes, try those positions. Try them. I mean, if you're not getting anywhere trying to apply for medical coding, try to apply for those alternative positions. I'm just saying. And best of luck to you out there. With that said, I'm going to wrap this one up. If this video helped you, I hope that you'll like, subscribe, and share. And I will see y'all next time. Bye.